Good morning, everyone. Welcome to the webinar, Resources and Services to Help You Manage Diabetes. I'm Sue Lockenmeyer. I'm with the Living Well Center of Excellence here in Maryland, and I'm your moderator for today. Our speakers today are Ms. Langley, Dr. Peters, Dr. Rodriguez-Weller, Ms. Vaith, and myself. And more about each later in the presentation. I do want to encourage all of you who are attending to submit questions via the Q&A tab throughout the presentations. We will have time after everyone presents for a lengthy conversation, so you'll be able to also share not just questions, but some of your own experiences by raising your hand in the Q&A box. Now I'd like to get started by introducing Ms. Anne Langley. She is Director for the Center for Population Health Initiatives, Maryland Department of Health. In this role, she helps Maryland achieve specific population health improvement goals with an initial emphasis on diabetes. Prior to joining the Maryland Department of Health, Anne served as Senior Director of Health Planning and Community Engagement at Johns Hopkins. In joining her is Dr. Sadie Peters. She is the Medical Director in the Center for Population Health Initiatives at the Maryland Department of Health. She's an internist who spent 8 years in clinical work at Johns Hopkins Community Physicians before joining the public health sector. Dr. Peters is very interested in innovative interventions that expand population-level preventive health and management of chronic diseases like diabetes. I'm going to turn it over now to Dr. Peters and Ms. Langley to begin. Please unmute your mic.
Hi, Sue. Thank you very much for the introduction. This is Anne Langley. I want to really thank you all for coming and encourage you to ask your questions, complete the post-webinar survey. Please tell us what other kinds of programming and other resources you'd like to see. We are just beginning on a long journey and want to make sure that we're offering programming that's helpful. Next slide. I just wanted to start out by noting the Maryland Diabetes Action Plan. This is a really rich resource that was produced over the course of most of 2019 and released at late fall of last year. It's a great resource. It has a lot of data and graphs, background information about the scope and impact of diabetes in Maryland. And it also describes interventions across the continuum. So it's not just about people with diabetes. It's about how do we in our state increase the number of people living at a healthy weight? How do we help people who struggle with their weight? How do we prevent people who are on the verge of diabetes, being diagnosed with prediabetes? How do we help them prevent that step? And also, how do we help people with diabetes manage their disease and live well? The link is there at the bottom, and I just wanted to note that this is an effort that requires all of us, all the partners, all the different sectors, providers, health systems, lots of community groups, schools, employers, payers, state and local government, and many others. And as you are find the need for resources and are seeking them, please look beyond your healthcare provider to all these other partners. Next slide. This webinar is about finding resources, and I just wanted to take a moment to note that diabetes is complex. It impacts all aspects of life. Your doctor, clinician is your probably your first resource, but to manage diabetes and get the support that is helpful, please reach out beyond that to other resources. And I just wanted to note these two on the web. Certainly there are a lot more local and personal resources to be helpful, but these are actually, I find them, I'm not a clinician, and I find them really helpful. Both the American Diabetes Association and the Association of Diabetes Care and Education Specialists have a section on their websites that is for people living with diabetes. And I find it a really accessible and helpful resource. Next slide. Um, we all know that food and eating well is so critical. It's critical for everybody, but it's especially critical for people with diabetes. So I just wanted to note one resource is a nutritionist. Many insurance plans cover your visit to a nutritionist. It can be very helpful. It's not just about losing weight, but it's about eating well. There are a lot of food resources that are local, so they can be harder to find. United Way's 211 service is a great help. They have an especially robust sort of description of all the local health food resources. SNAP, your SNAP benefits, if you're not receiving them and you might be eligible, check into it. It's a great way to get access to more healthy food. There are some people who qualify for medically directed meals. That's a good one to ask your doctor. Meals on Wheels, area agencies on aging, the food bank, or many other resources. And I just wanted to put them up there because, again, eating well is a critical part of managing diabetes and living well. And with that, I'm going to turn it over to Dr. Peters.
Thank you, Anne, and we can have the next slide. Good morning, everybody. Again, I'm Dr. Peters, the Medical Director in our Center for Population Health Initiatives. We have a lot to share with you in this webinar, and I think you'll get some fantastic information after Anne and I are done. It's exciting that we get to be part of this conversation. I wanted to start by saying that, as Anne mentioned, there are lots of resources in the community for people living with diabetes and families who are supporting those people, as well as people who have prediabetes and are trying to understand more about how they can help their health. We wanted to highlight just a few of resources that you might not have thought of that we really think would be helpful. So it might surprise some of you to know that smoking may actually play a role in the development of diabetes. There's evidence that smokers have a 30 to 40% higher risk of developing diabetes compared to people who don't smoke. As diabetes is a condition that affects the blood vessels, excess sugar in the blood vessels may change how the blood vessels work. And as the toxins in cigarettes and some other tobacco products also impact the blood vessels. It's thought that if you smoke and have diabetes, there's some synergy and it really makes the impact on the blood vessels much worse. So in Maryland, there is less diagnosed diabetes among people who have never smoked. So that's the red bar to the very far left on the screen, compared to people who have either smoked and have stopped, so they're former smokers, or people who are current smokers. Those are the two bars in the middle of the graph that's on the left there. But if you do smoke and already have diabetes, it's never too late to quit. If you smoked last yesterday or this morning, you could choose right now to make that last cigarette that you had the last cigarette that you'll ever have. It's a pretty powerful thing to be able to say that. The Maryland Department of Health manages the Maryland Quit Line, which is a free service, and I want to repeat that, it's free for all Maryland residents who are 13 years or older and who want help quitting tobacco use. This service has been used over the many years by many people. It has been extremely helpful to many people, and the professional staff from the Quit Line can help you connect with local resources, so resources in your county and in the area where you live, so that you can actually get long-term help quitting tobacco use, because it does take many tries for most people to actually stop, and you want to know that you have that support over that long period of time that it might take. The number is pretty easy. It's 1-800-QUIT-NOW, and the website is also very easy to find with a Google search. Next slide, please. So let's talk about your mouth, gums, and teeth. The American Dental Association has identified periodontal disease, which is gum disease, as the most common dental disease affecting people who have diabetes, and affects nearly 22% of those diagnosed with diabetes. This is especially true with increasing age. Poor blood sugar control increases the risk of periodontitis. And people who have poor oral hygiene, periodontitis can cause serious gum disease that damages the soft tissue and actually starts to destroy, if it's not treated, destroy the bone that supports the teeth. This can lead to tooth loss, which makes it a lot harder to eat well to take care of your health. The Maryland Oral Health Resource Guide is put together by the Office of Oral Health at our Maryland Department of Health. And it's an excellent directory of dental public health resources that are actually low cost or discounted or for people with special needs. And those are the only programs that are listed in this resource guide. It doesn't have the private dental offices which require insurance. It's only the facilities or programs that are low cost, discounted, or for people, offer services for people with special needs. It lists the services by county, there is an extensive amount of contact information as well as the list of services that are provided by those facilities. There are lists for some services that are in Washington, D.C., as well as some that are in Delaware as well, for those who live in those areas. And this resource guide is updated annually. Next slide, please. Back one. Diabetes and disabilities. A disability is any condition or impairment of the body or mind that makes it more difficult for a person to do certain activities and to interact with the world around them. More than 21 million adults in the United States have been diagnosed with a disability. And so many of these folks have difficulty climbing stairs or walking or seeing or hearing or concentrating and making decisions. We mentioned disabilities today because diabetes and disabilities are linked. In some cases, a disability may contribute to the development of diabetes. So if you have, if you're on a long-term medication like prednisone for a particular condition, that medication could change the way your body processes sugar over a long period of time from the food that you eat, and you may develop diabetes. Some medications change the way the blood vessels work, and that may contribute to diabetes. But in other cases, the diabetes comes first and may contribute to a disabling health issue. Some people who have had diabetes for a really long time may get damage to the small blood vessels that supply nutrients and oxygen to the eye. And so those people with diabetes may then develop a disability of severe vision loss. In some cases, the disability and diabetes may occur together, and so it's hard to tell which causes which or which came first. In Maryland, diabetes is at least twice as high among people with disabilities of mobility, cognition, hearing, vision, self-care, and independent living challenges compared to people who do not have one of those disabilities. And that's reflected here on the graph. In the red, folks who have a disability have twice as much diabetes as those folks who don't have one of those disabilities. The Maryland Department of Disabilities has many resources to help. If you have diabetes and a disability of mobility, you may need help with transportation, and they can help. If you have diabetes and a disability and you need help with housing, they can help. They can also help you contact organizations and the local agencies in your communities who can provide help, again, over a longer period of time. The website and contact information are here on this slide. Next slide, please. People with diabetes may face particular challenges during natural disasters and states of emergency like this novel coronavirus pandemic. If you need medications and it's not easy for you to get to the pharmacy or to your doctor's office, it can be pretty scary. If you lose electricity and your refrigerator is where you store your insulin and the refrigerator is, no longer cold, what do you do? If you have advanced diabetes and and kidney failure and you're on dialysis, what are your options for your regular dialysis if there's a huge snowstorm and you can't get out the door of your house or out of your apartment building to get to dialysis? These are all situations that are more and more frequent and increasingly challenging to people who are living with diabetes. But it's important to remember, just as workplaces and schools have written plans for fire drills and they execute those and everybody does them all together, it's important for individuals and families with diabetes to have solid emergency plans in place so that they're ready when you need them. The checklist on this slide is just a snippet of some of the things that should be done for preparedness if you have diabetes. This one is from the website of the Office of Preparedness and Response at the Maryland Department of Health. But the American Diabetes Association also has lots of tips and information about preparing for emergencies if you have diabetes. You should also know that each county health department in our state has an emergency preparedness point of contact. These are people who it's probably a great idea for you to find out who they are, go to your county health department website or call and find out who that person might be and get to know them so that you can get help that you need ahead of time, as well as somebody who may be invested in your health during an emergency, and you'll be better prepared in that respect. Finally, I would want to recommend that everyone with diabetes and families who support people who are living with diabetes and pre-diabetes to take diabetes self-management education courses. You'll hear more about those a little bit later on in the webinar. These kinds of classes help you to feel much better prepared to handle emergencies. And I think that they're actually a really good way to be prepared all the time. So part of what we wanted to do here in the beginning was to just let you know that there are many resources in the community for diabetes that are beyond the clinic walls, beyond your doctor's office. These are just a few. Please keep listening. You'll hear a lot more. And again, you are not alone in this journey with diabetes. Sue, back to you.
Thank you so much, Dr. Peters and Ms. Langley. I have to say, wonderful, basic, important information that's so important for all of those who are on the webinar. And I do want to remind you all that this webinar is being recorded. You will be able to access it and share it if you'd like. And we had one earlier that's also available as a webinar recording. So I'm going to introduce our next presenter. Dr. Nancy Rodriguez-Weller is on faculty at the University of Maryland Eastern Shore Pharmacy Practice. She is an advanced pharmacy practice experience preceptor in geriatrics. She focuses on medication use in the elderly, including dementia and depression in older adults, and has been incredible in the work that she's done in community, linking people to appropriate medications and having those discussions. I'm going to turn it over to you right now. Dr. Rodriguez-Weller, please unmute your mic.
Okay, thank you. Thank you, Sue, for that wonderful introduction. I'm very happy to be here to discuss this very intricate and important topic. Next slide, please. So my goal for this presentation is to give you some tips on how to manage your diabetes. I'm sure that you're aware that there is no cure for diabetes, but it can be treated and controlled. So the agenda for my discussion is going to include talking briefly about the disease and the treatment goals. I'm also going to give you some tips on medications and how to manage them. And I will also discuss some nutritional supplements that can be added to your treatment plan. And then finally, I would like to discuss the role of the pharmacist as a resource in helping you manage your plan. Next slide, please. Okay, so to start, let's briefly talk about the differences in diabetes type 1 and type 2. People who have type 1 diabetes don't produce insulin, a hormone that helps the body use sugar, glucose, which is a key source of energy that comes from carbohydrates. Now, if you have type 1 diabetes, you have to make up for the lack of insulin with insulin therapy. And typically, people are diagnosed with type 1 diabetes in their younger years. Next slide, please. People with type 2 diabetes produce insulin, but their bodies don't use insulin properly, or they don't produce enough insulin. So diet, exercise, and medication can often work to control glucose levels. But keep in mind that these measures aren't enough, and insulin therapy is needed to better control blood sugar levels. There are some risk factors that are present in people who are predisposed to diabetes, one being African American and of Hispanic backgrounds, being sedentary, being obese, having hypertension and high cholesterol, or having a history of gestational diabetes or polycystic ovarian syndrome in women. And one thing that we typically forget is that diabetes can be exacerbated by drugs, such as thiazides, the drugs that are used to treat hypertension, or even the antipsychotics or corticosteroids. So how can we prevent type 2 diabetes? So the risk factors like family history can't be changed, but there are other risk factors that you do have control over, such as making sure that you're maintaining a good diet, decrease in smoking and alcohol, increase in exercise. Those sorts of things are modifiable. Next slide, please. So the treatment goals, specifically in older adults, are a little different because as we age, there are some things that, that happen. And in an older adult, when we want to treat a diabetic condition, we also want to account for the control and the presence of blood pressure, cholesterol, and other heart conditions. In a healthy individual, the A1C is typically recommended to be at less than 7.5%. The fasting glucose at 130, the bedtime glucose at 150 and below, and keeping the blood pressure at least below 140/90. And in some cases, it is recommended to start a statin in a person who has high cholesterol. Now, in a more complex individual, the guidelines or the goals are a little less stringent. In a complex individual, the A1C is recommended to be less than 8, the fasting glucose less than 150. The goal in bedtime glucose is at less than 180. And the blood pressure, again, same as in a healthy individual, so should be maintained at less than 140 over 90. And a statin is usually recommended unless there is a side effect or contraindication to using it. In individuals who have poor health, the goals are even less stringent. The A1C is less than 8.5%, the fasting glucose less than 180, the bedtime glucose at less than 200, and the blood pressure is usually recommended to be less than 150 over 90. And we need to consider the benefit of using a statin in these types of individuals. Next slide, please. So the goal is to keep your blood glucose as normal as possible by maintaining fluid intake with medications and activity. You will want to keep your blood cholesterol and triglycerides as near normal as possible. And controlling your blood pressure is very important. It shouldn't go over 140 over 90. And then, as Dr. Sadie Peters suggested, we also need to keep an eye on some other diabetic health problems, such as making sure you're going to the dentist, the eye doctor, also interacting with a dietitian, maybe even a fitness professional, a mental health professional, and making sure that you're following up with your primary care physician, a podiatrist, and an endocrinologist if problems arise. Next slide, please. So how can we do this? How can we achieve this? Well, the first thing you need to do is plan what you eat. Follow a balanced meal plan, such as the DASH diet, which is a diet that helps in lowering and controlling high blood pressure. And this type of diet emphasizes on lowering sodium and taking foods that are rich in potassium, magnesium, and calcium. And people that have type 2 diabetes should exercise at least at a minimum of 150 minutes per week or 20 minutes per day, maybe even spread out over a 3-day period during the week. Limiting alcohol and not smoking is also very important. Maintaining your blood pressure and blood glucose. And one of the most important things, making sure that you are taking your medications and following up on your appointments. Next slide, please. So these are the medications that are used to treat diabetes. This is the different classes that are available. They act in different ways. Some stimulate insulin. Others decrease the production of sugar or absorption of glucose. And one thing that I often am asked, can I take both pills and insulin to control my blood sugar? And the answer is yes. The combination of insulin and an oral medication, when taken as directed by your physician, is very safe and effective in controlling blood sugar. A typical combination therapy consists of taking an oral medication during the day and maybe insulin at night. If you are prescribed insulin along with your oral, it's very, very important to make sure you're monitoring your blood sugar, because these combination therapies are helpful. But the treatment needs to be monitored to get a better control of your blood sugar. Next slide, please. So to treat diabetes appropriately, your pharmacist and physician usually use a patient-centered approach. And what that means is that we usually try to look at you as a patient. You need to think about other diseases you may have, whether you have low sugar readings causing hypoglycemia, whether there are concerns with weight or medication cost. side effects, or patient preference. So these are all considerations that we need to keep in mind. Here is a list of the more commonly used medications to treat type 2 diabetes, and there are a lot of differences between them. Some medications can be administered once or twice daily. Next slide, please. I'm sorry. This is a list of the more commonly used medications used to treat diabetes. And again, there's differences between them. Some medications may be administered once or twice daily. And this is very important in terms of compliance. We need to consider side effects. Some cause diarrhea, some cause nausea and vomiting, and some cause a drop in sugar. Weight gain can occur in some of these. And there are also some differences in how the medications are to be taken, either taken with food or taken first thing in the morning. Some require monitoring for patients who have kidney disease, and some provide some additional benefits that may be recommended in people who have cardiovascular conditions. Next slide, please. The nutritional products, when we talk about these replacement products, there are quite a few brands out there: Glucerna, Boost, Ensure, Resource. And if you're interested in trying a meal replacement, either in place of a meal or a snack, it's always a good idea to first talk with your dietitian. He and she can help you choose one that meets your needs and preferences. Now, these products are not all the same. Some have more protein than others. Maybe there's a difference in carbohydrates and the amount of sugar, the amount of fiber, and some do contain vitamins and minerals. It is typically recommended to use a supplement that ranges between 180 and 250 calories for a meal. And if you're looking for something to snack as a replacement, you need to have at least 80 to 150 calories per serving for a snack. Next slide, please. So we covered the clinical aspect of diabetes, and now I'd like to offer you some tips as to how pharmacists can help. We provide all sorts of information and support. One of them being there are diabetic services and supplies that Medicare, either Part B or Part D, covers. And many of these services may require a deductible or a copayment. Some services are free if your doctor orders them. But what I would like to say is check with your own plan to learn exactly what is covered. Next slide, please. Pharmacists can also provide all sorts of financial information and support. There are websites that can make it easier to find the exact medicine or supply that you need at the lowest costs. Look for reputable websites that sell the same high quality medicines as your local pharmacy. And providers usually advise against skipping medication doses or leaving prescriptions unfilled to save money. These are some of the examples of resources that you may find very helpful. Some provide seniors who have limited incomes. They can provide help with medications, healthcare, even rent. Some provide other services such as help with supplies, and there are quite a few that provide coverage and assistance programs, state programs, or discount drug cards. Next slide, please. These particular resources provide lots of other information, such as books that focus on diabetes. There are even diabetic cookbooks and other items that help with promoting health and awareness around diabetes. The drug companies, interestingly enough, do provide some of these services as well as financial help. Next slide, please. So these are the references that I've used to come up with these discussions. If anyone has any questions at the end, please feel free to ask. We're here to help. Thank you.
Dr. Rodriguez, thank you so much. This was really important, critical information. We're getting so much information today that is important to those of us with diabetes or our family members. So that's absolutely wonderful. And I'm going to move it forward to introduce Sue Vaith. She has years of experience in aging and disabilities management and leadership positions. She is the diabetes coordinator at the Maryland Department of Health. And she's going to be talking with you about a number of the programs that will really help you as you move forward. Sue, take it away.
Thank you, Sue. You can go to the next slide, please. And the next. So today I'm going to talk about two programs, one for diabetes prevention and the other for diabetes management, and how to find classes for each one. The National DPP helps people at risk of developing type 2 diabetes to prevent or delay it, and the diabetes self-management class is for people already diagnosed with diabetes. Next slide, please. Both of these programs are proven to help people maintain or improve health status related to prevention or management programs. The National Diabetes Prevention Program, or National DPP, is for people who don't have diabetes but are at high risk for getting it. It's intended to help people with prediabetes who are at risk to learn to take better care of themselves and reduce the chances of developing type 2 diabetes. The Diabetes Self-Management Education and Supports Program, or Dsmes, is for people with type 1 or type 2 diabetes and is intended to help people learn to take better care of themselves and reduce the chances of developing diabetes-related complications, such as eye, nerve, and kidney damage, cardiovascular disease, and foot damage. Next slide, please. So first I'm going to talk about diabetes prevention and have included it in this presentation as many people have or know someone who is at risk of developing type 2 diabetes. The National Diabetes Prevention Program is a year-long program for small groups of people who are at risk of developing type 2 diabetes. In these classes, people learn real changes such as healthier eating, adding physical activity to their daily lives, and improving problem-solving skills. Next slide, please. So research shows that the CDC recognized lifestyle change program participants, or those participating in the National DPP, who lost 5 to 7% of their body weight and added 150 minutes of exercise per week, cut their risk of developing type 2 diabetes by up to 58%. And for older people or people over 60 years of age, it was 71%. So even a decade later, program participants are 1/3 less likely to develop type 2 diabetes than individuals who did not join a program. And the program can also lower your risk of having a heart attack or stroke, improve your health, help you feel more energetic, and even reverse your prediabetes diagnosis. Next slide, please. So all program participants must be 18 years of age or older at the time of enrollment and must be overweight or obese as measured by a body mass index, or BMI, of at least 25 or 23 for people who are Asian American. Participants will need to qualify based on a recent blood test or blood glucose test within the year that is higher than normal but not high enough to be diabetes. Or they may have a history of gestational diabetes or have screened positive on a prediabetes risk test. Participants may not have a previous diagnosis of diabetes prior to enrollment and may not be pregnant. Next slide, please. So every provider offering this program has been approved by the CDC. The National DPP uses an approved curriculum with lessons, handouts, and other resources to help you make healthy changes. A lifestyle coach specially trained to lead the program will help you learn new skills, encourage you to set and meet goals, and help keep you motivated. The coach will also facilitate discussions and help make the program fun and engaging. It is a pretty fun program. It takes place in groups, so you may give and receive support from each other, share ideas, celebrate successes, and work to overcome obstacles that you meet. In some programs, the participants stay in touch with each other during the week, and it may be easier to make changes when you're working as a group than doing it on your own. This is a program that may be offered in person, online, or some combination of that, which is especially important during the COVID-19 emergency. The National DPP is structured as a one-year program with weekly sessions for the first 16 weeks, then moves to every other week or monthly for the rest of the year. And you might think it sounds like a long commitment, but learning new habits, gaining new skills, and building confidence takes time. And if you are able to delay, not develop diabetes or delay it for several years, that is a win. The National DPP is covered by Medicare, and in Maryland, it's covered by the Health Choice Managed Care program in Medicaid. Next slide, please. The National DPP classes focus on healthy eating and adding regular physical activity to help with the goal of losing at least 5% of your body weight. It also provides information and practice on dealing with stress, coping with challenges in your life that might get in the way of making healthy choices, and how to get back on track if you stray from your plan. Some providers do grocery store tours and cooking demonstrations. And in the second half of classes, you're going to enhance the skills that you've learned so that you can maintain the changes that you made in the first half. Next slide, please. Ultimately, you're going to learn how to create a healthier lifestyle to reduce the chance of developing type 2 diabetes by setting goals, using the tools you learn to eat more healthy and be physically active. Next slide, please. This is the prediabetes risk test that I mentioned earlier that people can use to indicate their risk of developing type 2 diabetes. Next slide, please. This is a map that illustrates where the programs are in Maryland within about a 10-mile, 15-minute drive time radius. You'll see that there are some gaps in there, but there are online and distance learning programs that are available that help fill those gaps. Next slide, please. Now I'm going to talk about diabetes management for people already diagnosed with diabetes. Diabetes Self-Management Education and Supports, or DSMES, is a 10-hour program for small groups of people with diabetes. It's been proven to help people to learn how to manage their diabetes through the course of this disease and help prevent or delay complications. Next slide, please. In people with diabetes, it's been, there's been a lot of evidence that links participation in a DSMES class to positive changes in health behaviors and improved diabetes-related outcomes. And these include improved glucose levels or blood sugar levels, improved control of blood pressure and cholesterol, higher rates of medication adherence, fewer or less severe diabetes-related complications, healthier lifestyle behaviors such as better nutrition, increased physical activity, and use of primary care and preventive services, enhanced confidence in how to handle the disease, and decreased healthcare costs, including fewer hospitalizations and readmissions to the hospital. Next slide, please. DSMES providers go through a rigorous accrediting process and have an approved curriculum with lessons and other resources to help you make healthy changes. Eligible participants can have type 1 or type 2 diabetes and can also be family members of people with diabetes. It's a 10-hour program facilitated by diabetes educators, nurses, or pharmacists, and may be delivered as group or individual sessions depending on the need. Most insurance plans cover, including Medicare, cover up to 10 hours of diabetes education in the first year of diagnosis. After the first year, your coverage may be different, so you might want to contact your insurance provider for more information. At this time, DSMES is not covered by Medicaid. Next slide, please. So when you're first diagnosed with diabetes, it's confusing to know what you need to do, and the DSMES helps you learn to make the best decisions for you. you should ask your doctor for a referral to a DSMES class. In the class, you're going to learn how to stay healthy and how to make what you learn a regular part of your life. So it will include working with your healthcare team to get the support you need, understanding how to take care of yourself, and learn skills, again, about how to eat healthy, be active, checking your blood sugar, taking your medicine, solving problems, coping with the emotional side of diabetes, and reducing your risk of other health problems. Next slide, please. So it's important to go for DSMES services when you first find out you have diabetes so you can learn how to take care of yourself. There are other times that DSMES can help as well. So you want to check in with your doctor every year. When new situations occur, such as developing new health condition or if you have depression, and when other changes happen that might affect your diabetes. Next slide. And this is a similar map to the one I showed earlier. This shows the location of DSMES program providers. You can see that both of these programs are spread throughout the state. And again, these classes may be offered using telehealth during the COVID-19 emergency. And we're actually hoping that that will continue after the emergency is complete, is over. Next slide, please, and the next one. So there are several ways a person can find and be referred to the National DPP and DSMES programs. Our office maintains a customized website, the BeHealthyMaryland.org, where program providers may advertise their classes, and then people can use the site to find classes and refer or self-refer. So if you can't find a class when you go to the website, you can find a list of providers in your area and then contact them directly to find out when their next class is. For DSMES, you can ask your doctor for a referral. And you may also, for the National Diabetes Prevention Program, you may refer yourself. If you're a Medicaid MCO member, you may ask your MCO to connect you with a provider. Next slide, please. So this is a screenshot of the website BeHealthyMaryland.org, where you can find classes and contacts for the National DPP and DSMES. Next slide. You can search for these classes as well as other programs that might be of interest. So there's a list there of programs that you might be able to get besides the National Diabetes Prevention Program or the DSMES program. So all of these resources can help you, assist you learn more about diabetes management and prevention and some resources, and also learn more about these programs. And I thank you so much for your time and attention.
Sue, thank you so much for that very informative presentation, really showing people these wonderful resources and where they're going to be able to find workshops, programs that can help them moving forward. So I am your next presenter. As I said, I'm with the Living Well Center of Excellence, which is part of MAC Inc., an area agency on aging on the lower shore of Maryland. And I oversee implementation statewide of a lot of evidence-based programs, provide leader trainings for these programs, and really work on implementing a lot of different programming. So next slide. These are just some of the evidence-based, what we call healthy aging programs across the state. We say healthy aging, but the majority of them, again, require that you be 18 or older to access them. And one of the differences in some of the programs I'm going to talk about is that the individual who has diabetes, but also family members can come to the program. So that's an important piece to understand, particularly if you or a loved one has diabetes, but you really want your team at home to really assist with helping you manage. Next slide. So why these programs work? Sue talked a little bit about this, and so did Dr. Peters, but the programs I'm talking about are led in the community by people just like you. They're from your community. They may have diabetes or have a family member with diabetes. And so they're people with concerns that are similar. So what we know about diabetes is that people deal not only with that, but also the impact it has on our lives and our emotions. And people with diabetes or prediabetes are certainly more likely to identify with and trust individuals, facilitators, leaders who have had similar experiences. And as I said, importantly, family members and caregivers can be active participants. These programs are almost always presented at no cost to the individual and community. Next slide. So the goals of the Diabetes Self-Management Program is really to assist the individual with the disease to accept responsibility to manage or co-manage that diabetes, to become an active participant in the system of care. And Dr. Peters has talked about this more than once. Really, you yourself are an important key part of your healthcare team. So it's you and the rest of the team. And then finally, these programs really do assist you in gaining confidence to be able to perform the tasks and to focus on improving your health and access any of the needed healthcare services that you need. Next slide. So these are really the key components of the Diabetes Self-Management Program. Again, it's around strategies like decision-making, problem-solving, action planning, physical activities. More information about what diabetes really is, information on monitoring, how to create a healthy eating plan, how to prevent low blood sugar, how to prevent or delay complications, strategies for sick days, and foot care, all important components when you're dealing with diabetes. Next slide. So this is what we call our toolbox, and all of our chronic disease self-management programs are pretty much have a similar toolbox depending on the disease, but for diabetes, focus is really on, you can see, healthy eating, physical activity, that monitoring component. We already mentioned action planning, stress management, understanding your own emotions. Medication, also tremendously important, and thanks to Dr. Rodriguez Weller for the wonderful information she shared. Using your mind, you know, we forget sometimes that we think, we worry, we get frustrated, but we can use our mind in positive ways as well. And there are a number of activities that include that. Avoiding complications, improving communication with your healthcare provider, with your family members too. And then that decision making, and I know Dr. Peters already spoke about not smoking and how key that is. Again, working with, learning to do problem solving on your own and working with your healthcare professionals. So that's really all of these components in one of the workshops. Next slide. So again, as I said, it's a program that's open to individuals over 18 with or without diabetes. It's a 6-week workshop, generally about 2.5 hours per session. So normally it's a group session. Right now, we don't have very many actual in-person groups going on, but we certainly are doing virtual workshops all over the state. It's facilitated by 2 leaders who are trained. They're usually non-health professionals, but they have experience with chronic diseases and or are caregivers. The materials are standardized and people follow a script in it. And as I said, they're free or low cost. Participants really do learn to become active in managing their own care. And these programs don't replace existing programs or treatments that you might already be involved with. Next slide. So these are some of the measures that we look at both pre the 6-week workshop and after it. And we find absolutely huge improvement in individuals' ability to have more self-confidence in how they manage their health, in how to set and follow an action plan, in feeling more motivated to take care of their health, better understanding how to manage both their disease, but also the symptoms of their disease. And then having, as I said, really more overall confidence as a measure. Next slide. So I just wanted to share a few successes with you. Mary H. is a person who was referred to the Diabetes Self-Management Program. Her A1C was 9.9. Her ring finger had been amputated. She'd had a small wound that got infected and they couldn't save the finger. She was frustrated and scared, needed guidance and support. And so she went through the program. She really recognized she had to refocus on her health, made amazing progress. And so now her A1C is at 6.1. So importantly, after taking the workshop, she's no longer so worried about her future, and she's confident that she has the knowledge to take better care of her health. And next slide. So Mrs. M really didn't know much about diabetes. She'd been recently diagnosed with type 2 diabetes, and her doctor told her about the Living Well with Diabetes workshop. It helped her to understand what diabetes is, how to deal with it. Again, she talked about the importance of the meal planning, the nutrition label reading, paying attention to portion size, and then all of those key factors around exercise and weight control. And so she said at the end, you know, thank you for providing this class. It really was a chance to talk with others who have diabetes and for the great textbook. Now I can look things up at home whenever I need to. It's really awesome. So again, these are just examples of people who've gone through the program and really the difference that it can make. Next slide. So I did want to share, and you know, this particular webinar has been full of additional resources in the community, both from Dr. Peters and Ms. Langley, and from Dr. Rodriguez-Weller as well. But your local area agency on aging has a number of programs that may be important to you in terms of nutrition. These are all really programs that are accessed through our Maryland Access Point, No Wrong Door information and referral system. So you can see there is nutrition counseling, there are meal programs, and list of community food resources and enhancements and so on. Financial assistance, including SNAP and Medicaid and other resources. In-home care for certain individuals who may need someone, assisted living facilities, telephone reassurance and options counseling. And then medication management assistance for dental, eye care, and hearing aids. Social support from senior centers. Unfortunately, the senior centers are not open now, but many of them are doing outreach virtually. Certainly support groups can be a connection as well. And then environmental assistance if people need housing or assisted living, local transportation systems, assistive technology and equipment, adapted telephones and ramp assistance, things like that. And then the health and wellness. So those are really those evidence-based programs I was talking about: chronic disease, diabetes self-management, cancer thriving and surviving, the diabetes prevention program that Sue Bath spoke a great deal about as well, a malnutrition workshop, stepping up your nutrition, falls prevention, and then depression and care management as well. So lots of different resources from the AAA. Next slide. And these are some more, again, a long list of things that you may or may not be aware of that are available from your area agency on aging. There is one covering every county in Maryland: elder abuse prevention and elder abuse exploitation services. Again, we talked already about the Maryland No Wrong Door information and assistance. Durable medical equipment reuse program, the senior call check program that can call an older adult every day at the same time just to make sure that they are up and about, and a call will go to an individual family member if there's no answer after 3 tries. There's senior Medicare patrol and senior health insurance program, which is SHIP. That's assisting you in terms of getting the right Medicare coverage. We already talked about health promotion and disease prevention, and then that nutrition and meal services is critical to so many. Caregiver Services Corps, again, another great resource, and Community for Life, another one for folks who are doing well, but their lives may be impacted by conditions. And then housing programs, again, the National Family Caregiver Support Program for any of you who are caregivers. assisted living subsidy programs, ombudsman advocacy, again, for residents if you're concerned about someone in assisted living or a nursing home, public guardianship, and senior legal assistance. Again, all of these are available from your area agency on aging in your local county. Next slide. So I want you to join us. Hopefully you will join us next week, same time, same place, for our next webinar, New Solutions, Medications, Nutrition, and More. And if you missed the first one, that is available through a recording. So I'd love very much to turn it over to folks who have questions or may want to share something. You can go to the Q&A and link on it and raise your hand if you've got a question or you want to share information. I'm going to ask all of our wonderful speakers today to turn on their mics and their videos so that they can answer questions. I know I have a couple in the chat already, or in the Q&A. I'm going to get to those first, and then we will go ahead and take questions from all of you. So one of the questions was, what vitamins are good to take to help manage diabetes? Dr. Weller, would you answer that one for us?
Absolutely. So it's recommended that diabetics maintain a good diet, and you can supplement that with a multivitamin with minerals. The vitamin B complex products are good, especially for diabetics who have neuropathy. So that would include vitamin B12, 6, and B1. Magnesium is another supplement that's recommended. Keep in mind that what we want to do in addition, besides maintaining diabetic health, is also making sure you're taking supplements that decrease hypertension. And that would include calcium maybe, and vitamin D, which is actually helpful in both hypertension and diabetes. Dr. Peters, do you have any other suggestions as to what can additionally help as well?
No, I think that all of those are good suggestions. One of the things that I would love to remind everyone is that most of what we can get, most of what we need to continue to be healthy, we can find in the food that we eat. So if we have a very good diet, then a low dose multivitamin really does have all of the things that Dr. Rodriguez-Weller mentioned. So you don't want to overdose on supplements, but you do want to, one, talk to your provider about what you might be missing, and continue to stress that eating healthy food is what's going to get you to where you need to be. It'll help maintain your weight. It'll help maintain your bones and your teeth and your brain function. So those vegetables and fruit that, we sometimes skip, those are very, very key.
That's great. And one of the questions we had earlier is, how do you set aside medications if your insurance only pays for a month's supply of meds at a time?
So how do you do that? The first thing that I would suggest be done is calling the insurance company. In some cases, they will allow exceptions, especially if you follow that with a rationale as to why you would want to keep an extra supply of medication. I actually had the experience a couple months ago to go to Puerto Rico, and the aftermath of the hurricane and the earthquake, and we had quite a few diabetics who did not take their medications because they didn't have pharmacies open. And so some of the drug companies actually were kind enough to give samples, and that's actually another way that you can maybe seek help directly with some of the drug companies, explain the situation. Most likely they will ask for a prescription and will maybe give you a supply of medication in case of emergencies. And that's a very important thing that we do need to think ahead of time, especially in this day and age where we have situations where we don't have accessibility to medications.
Great, thank you. And another question was, is this class offered through Be Healthy Maryland? I think it probably was the one that I was describing at the end. And yes, as Sue indicated, all of those workshops, not just the diabetes ones, but all of the other ones are also all listed on Be Healthy. So you can go and find one in your area and click on that link. And if you don't have one that's immediately available, it can link you to individuals who can connect you. Remember, we're doing so many classes now that are virtual. So that's a huge plus in being able to access them regardless of where the facilitators are who are doing the program. I don't see more questions in the chat. I want to encourage those of you who are on the call to please go into the Q&A and raise your hand right next to your name and let us know if you've got a question or want to share some experiences. But let me also turn it over to our speakers. You may have more information. And you know, Dr. Peters, I'm recalling that yesterday on a webinar, we had a question about whether or not you should be taking a flu shot if you've got diabetes. You might want to answer that one again today.
Yes, diabetes is one of the categories of health illnesses, of health conditions that really is a priority for the flu shot every year. So if you have diabetes, it is important to get that flu shot every year. There are different types of flu shots, and so it's important to discuss with your provider which type is the right type for you. There's some caution that is needed for the live nasal flu vaccine for people who have diabetes, so that's something to discuss with your provider. But every year, everybody with diabetes should get a flu shot. It's very important. I did want to add also to the response to how do you set aside meds if insurance only pays for 1 month's supply of medications at a time. It's a big problem for people. We want you to have an emergency kit with enough medications to last through whatever emergency, but yet if the medication is expensive and the insurance company limits that supply, you know, really what do you do? And I think it's a fantastic option to call the insurance company and say, look, we're having increasing numbers of disasters and I would love to have samples sent to me and or give me an exception to the prescription limit and send me a month's set of pills ahead of time. But some other sneaky ways that you can save up some medications are save the ones that you forget to take. We all miss pills. It's just one of those things. And if you're great at taking all of your medications every day because you have a pill box, wonderful. But at the end of a short month, February, for instance, you may have a couple pills left over because they gave you 30. And if you went out of town and you forgot to take a pill, you may have, so by the end of the year, you might have a week's worth of pills to take that you didn't take. Save those. Those can be part of your 1 week's supply of extra medications in an emergency. The other things that you can do are when doses change, say you were on a twice-a-day metformin, and then your provider switches you to a once daily long-acting medication that then you just take once a day, you might want to save that half-used bottle of twice daily medication. Talk to the nurse or the provider, the clinician at your clinic to see if you can use these in a pinch if you are, again, in a snowstorm and you can't get out and you've just used the last one of your once a day medication. So you want to discuss those options with your provider because they are options that you could use. You just have to make sure you have the right guidance and the right advice about how to use those medications safely.
Dr. Rodriguez-Geller, do you have more you want to say about medications?
Very important. Compliance is very important in managing diabetes. So if there is a problem with a medication, let's say that you have a side effect that you're not happy with, consult with your pharmacist and ask. There are some side effects that go away after a month. Metformin is a good example. Metformin tends to cause some GI problems early on when you first start, but it will subside after a period of time. You can also ask the pharmacist their recommendations as to how to take it. Should I take it with food or after food? Is there anything that interacts with the medication that I need to be aware of that intensifies or causes more adverse effects? But very, very important, making sure that you're compliant. If there are any issues about the medications that you're taking, communicate that with your pharmacist and your provider. Find out what other alternatives there are.
Great. We have another question in the Q&A, and that is there any research about the possible effects of COVID-19 vaccine and how that may impact somebody who has diabetes?
I don't have any information on that yet. We are still so new in the advent of the vaccines. So I think, you know, they're in trials. Lots of different types of vaccines and treatments for COVID-19 are in trials at the moment all across the world. So I'm sure that there are people with diabetes who are included in those vaccine trials. And I'm sure that sometime in the near future we'll have more information. But I am not aware of anything that's published and peer-reviewed and widely disseminated for the medical community that would give us information about the impact of the COVID-19 vaccine of any type on people with diabetes. We just don't have enough information yet.
Great, thank you. And actually there's another question here about the type of pneumonia shot that's available, and can that be taken at the same time with the flu shot?
I can take that one as well. Yes. Okay. So again, these are questions to discuss with your provider. The type of vaccine that you get for pneumonia depends on where you are in your age, as well as whether or not you've had a pneumonia shot in the past. So this is something that you'd have to discuss with your provider. And yes, they can be given at the same time. The flu shot and the pneumonia vaccine can be given at the same time. But again, it depends on you as an individual, how you have reacted to either of those in the past, if you've had one, and your willingness to sort of be, as my mother says, poorly, you know, kind of like, I feel kind of yucky, because sometimes there are, you know, some mild side effects in that you feel tired and your arm might hurt. So it's up to you and your provider to discuss whether or not you want to give those things at the same time.
I want to add that it's very important to keep up with the immunizations, especially in people who have diabetes and hypertension and other disease states. It is typically recommended across the board for people over the age of 65 to keep on a regular routine immunization schedule. And as Dr. Peters pointed out, the pneumonia vaccine is good for approximately 5 years, but there are differences in some of these products, and you would have to consult with either your pharmacist or your primary care provider to find out which ones are recommended for you as an individual.
Great, thank you. And one of the questions in the chat or in the Q&A is, after completing the post survey, which we want all of you to do, it's really important that you complete that. for a couple of reasons. It will help us in terms of planning future programming and identifying where there are gaps that need to be really addressed in terms of diabetes. But the question is, how long after completing the post-survey does it take to receive your certificate from each webinar? And I think we've got that process that we're down pretty well. It's taking us a bit of time to collect the post-surveys, but you should be able to access that certificate of completion within a couple of days. And if not, you can certainly reach out to our system, or you can reach out to me and we'll get it figured out for you. And I do have one hand raised, and so let's open again for, let me see. I believe it's Shirlene, right? You're asking, how can you view the presentation? Maybe you were not able to see it. I'm not sure.
Right, so Shalala Campbell has a question in the audience.
Okay.
Her mic's on, she's ready to go.
Oh, great.
Oh, I'm sorry, I don't have a question. I probably hit it by accident.
Well, so just tell us what brings you today to the webinar, and are there things you learned that were helpful? Do you have any other questions?
Well, I do have diabetes type 2.
Mhm.
I was diagnosed 2 years ago. When I was first diagnosed, my sugar level was 509, and I was like totally unaware. I was losing a lot of weight,
Mhm.
but I really thought it was because I was exercising 3 times a day and running around and eating healthy or whatever. But after that, of course, as you guys went over today, my doctor had put me on metformin and insulin, and now I've been managing it well. My goal is to be a glucose level to be 100 when I wake up, and after 2 hours of eating, 140. So I've been managing that. I have had slip ups and relapsed, but of course, educating myself and continuing to follow up with my doctor, got myself back on schedule. So I just came for the resources, as I educate myself, I can educate others. So thank you. And I remember not to overdo the vitamins, because I do take a lot of vitamins.
Mhm. Mhm.
Thank you for sharing that. That's wonderful, Shannon. And again, people are asking about the presentation and can they view it later? Absolutely, you can view it later. And also, if you've got other folks who are interested, they can view it. And if they complete the post survey, then they can get a certificate of completion as well. We really want people to be better educated, more motivated. So these programs will be accessible. Remember, you're watching the ones that are for people with diabetes, but there are some for direct care providers and there are some for clinicians, and you can access all of them. All right, and there certainly is valuable information that's presented in every one of them. Suvaith, did you have anything you wanted to say, or Anne Langley in closing? We're getting close to closing time.
This is Anne. I'd like to ask Shalita if she'll continue to be on work with us here. When you first hit that, found out about your sugar level, what, I guess it's that point, like what went through your mind? What resources did you immediately know you needed or didn't know, but look back and think, that's what I needed? That's for you, Shalita.
I'm sorry, my computer froze. Can you say that?
Oh, I'm just asking, when when at that time in your life when your sugar was so high and you learned of that, and we're kind of faced with this. I've watched family members go through that, like all of a sudden your whole life changes.
Mhm.
And I'm wondering, if there were resources that you wish you had at that time, or that you knew then, or that you look back and think, wow, you know, this particular thing would have really helped me?
I didn't have any resources. I actually went to the emergency room because I was going through some other things, other complications. And when she told me, she asked me, she just said, you know, your sugar level is 509. I'm like, well, what does that mean? So I was totally unaware of, you know, everything. And it was scary. And of course, I went home, started Googling everything. I challenged my doctor for a whole year, you know, based on what Google was saying. But one thing I do wish I listened to my doctor in the very beginning. And I complied with the treatment adherence. It took me a whole year to finally trust my doctor. So I tried other things my way, like, well, I probably can beat this and reverse it, but like you guys were saying, you have to really plan. It not only changes my life, but because I'm like the number one person that goes to the grocery store and do all the shopping, it changed my whole family's life, you know. So I had to get past the temptation. No more McDonald's, no more this and no more that. Can't engage.
Good for you.
That's a
Yeah,
really difficult journey. Congratulations.
thank you.
Absolutely. Absolutely. Sue Beth, did you have something you wanted to add here toward the end?
No, thank you, Sue. I really love hearing from Ms. Campbell and hearing about your experience. I'm just wondering if anybody else wanted to share their experience in terms of what kind of resources they would have liked to have had when they first were diagnosed.
I haven't.
All right, Charlene here. You know, I had what I thought were the symptoms. They talk about frequent urination, you know, being thirsty and all that. And I had gone to my doctor and expressed this. They took whatever test they have in the office, but it didn't register that my sugar was high or that I was diabetic. And it wasn't until I had gone to another doctor that he sent me for, I expressed the same thing to him about the frequent urination and all that stuff. And he sent me for a fasting glucose test. And it wasn't until then that I realized that I was told that I was diabetic. And at that time, when I went for it, she said, you know, I have to call your doctor before we do the test. And, you know, that kind of scared me, and I found out that my sugar was so high before I even took the test. That's why she was concerned. And it was on a holiday weekend, and I think he called me the first thing that Monday morning or whenever it was after the holiday, to come to his office immediately. And he explained that. But, you know, going through the testing that they do in the office evidently did not reveal that I had a concern. And I think about that often because I wonder if others may have the same issue and not really be aware of it.
Good question, and I thank you for sharing that as well. Dr. Peters, were you going to say something else? Sorry.
I was just going to add that, thank you, Charlene. Sometimes the point of care testing in the office is not as sensitive. So it's a test that does give a lot of information most of the time, but sometimes the test isn't perfect and it does miss. So it's really great that you were able to describe your symptoms. It's great that you persisted to say, something's just not right. Can you continue to help me figure this out? because it really does take people being aware of what's happening with their body and working in concert or in collaboration with their medical providers to find the right diagnosis and to find the right next step. So I applaud you for, for persisting and not just letting it go as, I'm getting older and my body's falling apart, because that's just, a lot of people do sort of give up because they don't get enough help from us as clinical providers. And it's really important that, that you do, because sometimes our tests are terrible. And I'm not saying that this point of care test is terrible, but the tests miss things and clinical providers miss things. So you as the patient or the person who's experiencing symptoms, it's fantastic that you felt the agency to keep going forward and get to the bottom of that. So thank you for helping your providers to help you.
Absolutely. Thank you for those of you who share, for those of you who ask questions. Again, this is really for you. We want to continue to provide information that will be helpful to you. We hope we will see you again September 30th from 11 to 12:30. And please, the brief survey should show up, an evaluation should show up right at the end of the webinar. Please do complete it and you will get your certificate of attendance. Thank you all for joining us today, and thanks to our terrific speakers. You did a wonderful job with wonderful, incredible, helpful information for everyone. Take care.
Thanks, Sue.
Thank you.
Bye-bye. Thank you.
Bye-bye.